Zac Denning from SBH. Welcome.
Thank you.
Now, SBH has a product specifically for macular degeneration. Tell us about how it differs from other preparations.
So our product Macular Protect Complete is unique in that it was the first product to combine the AREDS and now AREDS 2 formulation with a complete multivitamin, multi-nutrient formula.
What differentiates it from the standard AREDS 2 formula?
Because it combines a multi-all-in-one, we are preventing some of the issues that happen when patients are given a standalone AREDS formula and go to the store and end up perhaps buying something that's on sale or mixing and matching different combinations of vitamins that might not be appropriate or what the eye care practitioner has recommended.
What kind of feedback have you received from ophthalmologists and patients?
Ophthalmologists are often grateful to be given more control over their patients' care because frequently they're in the situation of not being in the driver's seat, of simply directing the patient towards the store, and the patient ends up doing something different. And so our goal is to help the doctors feel more comfortable. They often really appreciate that. And the patients also like the convenience of not having to combine different products.
What other products are you developing that have relevance to this area?
Well, we are constantly updating our formulas as new research arises. A good example is the WAFX study. It was an NEI-sponsored study that was larger and longer than AREDS. And as a secondary endpoint, it found a significant reduction in AMD risk for women, 30 to 40% roughly. And so when that study came out, we updated our products to reflect that research. So our products are always changing, they're never static.
What specific element did you update in response to that particular finding?
So there were 3 B vitamins that were studied, B6, B12, and folate. In response to that, we updated our formula with substantially higher levels of those B vitamins.
There's been a lot of discussion in the literature and in the press recently about quality of vitamins, whether the GMP standards are followed. The FDA recently did a random sampling of multivitamins and found extreme variability in the actual active components. What steps and measures are you taking as a company to ensure that your product is not only has the vitamins that it says, but the quality is consistent batch to batch?
Well, our products are manufactured exclusively in the U.S. In NSF-certified facilities. We conduct extensive laboratory testing to verify the potency and purity of the ingredients and that they match what the label claim is.
In terms of the shelf life of your products, is it shorter, the same, or greater than other products in the marketplace?
We are conservative in our shelf life. So our macular products, our shelf life is 1 year. I suspect they would probably last a lot longer than that. But we are very much focused on freshness. We know that some nutrients can degrade over time, and while they've been tested, we can't always control the environment that the patient keeps their supplements under. So we set a very conservative shelf life.
One of the big challenges is that multivitamins are added to so many different foods that we purchase over the counter. Foods such as cereals are routinely fortified, milk is fortified. Do you have an educational program that the ophthalmologist can use to educate patients about the fact that more vitamins are not necessarily better?
Well, I think that physicians are generally aware of that. Physicians are generally cautious about what they recommend to their patients, but the patients, however, need that kind of education. So we do a lot of patient education as well as doctor education about the latest research in nutrition and eye health, and that does cover safety in some cases, making sure that people know what levels are appropriate. Patients sometimes will try megadosing. They will They will assume that more is better, and that's why the physician has a very important role in the patient's care, in being the gatekeeper. And that's why our whole program is focused on making sure that the doctor has control over that process and has a hand in it.
Are you conducting currently any ongoing research? And if so, tell us about what that entails.
We are funding research into factors that affect macular degeneration, and we're also funding research that will be related to the optic nerve as well.
When can we expect to start seeing early data on that research?
Well, the research related to the optic nerve is pending publication right now. We don't know, but we expect in the next 3 to 6 months that we might see publication.
Is there anything else that you'd like to share with us, Zac?
As the first eye care company, Science-Based Health has always been an innovator, and we have often set the stage for what many even larger companies do in nutrition. Our products and formulas have often been emulated by other companies, and so we see ourselves as having an important leadership role. And while we may have a less visible name, we are often sort of setting a high benchmark that others look to us for and that doctors look to us for. So we are constantly pushing forward both primary research of our own and monitoring the research that's being done within the research community. We're often the first to respond to that for most health conditions throughout our history, and we continue to keep doing that and pushing that research forward, coming out with new products or new updates to products that really improve patient care and the doctor comfort with the patient's nutrition and eye health.
Zac, thank you so much for sharing your important perspectives on this key area.
Thank you so much. It's been a real pleasure.